Hello, my name is Dr. Charles Durr, and I want to talk to you today about peripheral neuropathy. Now, what is peripheral neuropathy? Now, it literally means death of a peripheral nerve, a nerve that is from the spinal cord level out to the rest of the body. It supplies all the muscles and tissues and organs and so forth. It detects information, sending it back to the brain, and it sends information from the brain back out to the body. Now, what are the symptoms of peripheral neuropathy? Now, typically you'll see numbness, tingling, burning, itching, a dead feeling. Sometimes it can be a sharp pain, sometimes it can be cold or heat, but the variety of times it's mostly numbness, tingling, and a lack of sensation in the early stages. And in extreme cases it can lead to muscle wasting and dropped foot and paralysis and things along those lines. Now, what are the causes of peripheral neuropathy? Now, there are many. There's mechanical causes, there's metabolic causes, there's neurological causes, but the underlying factor is lack of oxygen to the nerve, or a lack of glucose to the nerve. And that's called anoxia, or oxidative phosphorylation. Now, the metabolic causes of peripheral neuropathy are many. One of them, the leading causes, is a statin drug. Now, statin drugs deplete your coenzyme Q10, which at the cellular level is important for the production of ATP. So if your body can't produce these cellular regenerative enzymes, then there's a lack of oxygen, there's a lack of growth, and the nerve begins to wither. Now, some other metabolic causes of this are sometimes what's called hypochlorhydria, which means a decrease in stomach acid, and frequently caused by antacids or just the aging process and poor health. But what happens is you lack the nutrients and B vitamins and so forth to have adequate hemoglobin hematocrit numbers, and your body's ability to deliver oxygen to the body is decreased. So your oxygen saturation levels are below normal. Now, the peripheral nerves, and usually it's in the feet and the lower legs that we begin to see this, is the farthest distance from the heart. So obviously if you have a problem with carrying oxygen in your cells and your arteries aren't as efficient as they were, the body's capacity to carry oxygen and glucose down to the feet and so forth is compromised. So unfortunately, a lot of times we see what's called a subclinical anemia. And frequently, unfortunately, we'll see people with peripheral neuropathy who are often on a statin drug, they're often on a blood pressure drug, and they're often taking antacids. Now, the problem with blood pressure medication is that it may reduce the risk factor of having a stroke, but if you're having oxygen saturation problems, your saturations aren't as high as they should be, either due to anemias or some other factors, and your body tries to increase blood pressure to produce more oxygen delivery because you're not as efficient, and then you artificially decrease blood pressure, your oxygenation to your cells then will be suffering. And frequently that is an underlying cause of the peripheral neuropathy. Now, there are also mechanical causes: spinal stenosis, degenerative arthritis of the spine, bulging and herniated discs, pinched nerve and sciatica, all can be a cause of that. And they can physically compress the nerve, block the blood flow, block the oxygenation and glucose to the nerve. And if it's a mechanical cause, it's generally the most treatable. But what I found is generally most people have multiple causes: mechanical, metabolic, and neurological. Now, diabetics frequently have neuropathy because they have too much glucose in their bloodstream and it forces out oxygen. And so there's not enough oxygen getting into the cells. Obviously, it can't operate and it starts to die, literally. So the underlying cause of peripheral neuropathy is lack of oxygen, lack of glucose to the cells, to the nerve itself. And the nerve has its own specialized blood supply, and it has actually its own nerve supply. So it can monitor its own ability to keep track of its own oxygen and glucose. But when it becomes compressed, it frequently then cannot get the oxygen down to the deepest part of the cells in the feet and the lower legs. Now, there's also another mechanical cause called adverse neural tension. And this literally means that your nerves are being stretched or taut to the point where they have reduced their cross-frictional area. So if you imagine a Chinese finger torture, if you pull that finger toy apart, the cross-sectional area gets smaller. So if that nerve is actually being stretched, it becomes thinner and it's harder to get circulation in and out through the nerve. So these are just some of the most common causes of peripheral neuropathy. So our approach to treating peripheral neuropathy is both metabolic, neurological, and mechanical. So metabolically, we want to send you out for a complete blood work. We want to check for subclinical anemias, digestive or hypochlorhydria signs, blood sugar disorders, whether it be insulin resistance or hypoglycemia, or in fact if you do have diabetes. We want to look at the medications you're taking to check to see if you're taking a statin, to see if you're taking an antacid, see if you are taking high blood pressure medication. And from there we will do a nutritional analysis of your blood work to recommend nutritional changes in your diet and lifestyle and prescribe some specific nutrients and supplements to help you reduce the needs for statins, blood pressure, and antacid medications. We will then monitor your progress with repeated blood work and see how that part of the situation is going. Now, another big treatment protocol that we have is very unique here is glutathione treatment. Now, glutathione is your body's most intense, powerful antioxidant, and it's produced at a certain level. But if your body is overloaded with toxins and inflammation and free radicals, it becomes overburdened and your body loses its ability. So if you have toxic liver or what have you. So supplementing glutathione is critical for cellular regeneration, stopping oxidative phosphorylation and free radical damage, and in particular, healing nervous tissue. So what we do is we use 3 delivery methods of glutathione. We do it via nebulizer. Now, you can take capsules of glutathione, but they are broken down in the stomach and they won't be absorbed in the body. So we use a nebulizer. We actually have steam inhalation of the glutathione. We also have a cream that we put directly on the affected extremity and heavy massage in, and it's absorbed transdermally. And we also have a suppository option, which is highly absorbable and is also an option for people who have lung problems. But glutathione treatment is one of the cornerstone treatments for nerve tissue damage, and we have an excellent delivery system for that. Now, another treatment modality is oxygenation. Now, we use oxygen concentrators to increase your saturation of oxygen. So if you have decreased hematocrit hemoglobin, you have a problem with your tissue saturation, we will monitor that and give you concentrated oxygen to increase oxygenation to the cells there. So our metabolic approach is to do complete blood work, analyze dysfunctions, recommend nutrients and lifestyle changes, and supplement with oxygen and glutathione. That's our metabolic approach. Now, our neurological and mechanical approach is to look at the lower spine to see if there's degenerative disc disease, spinal stenosis, bulging and herniated discs, and what have you. And one of the most effective ways to combat that is decompression therapy. Now, decompression is a way to treat the lower discs to improve circulation, improve hydration, and decrease bulged and herniated discs. But what we found is when we're decompressing somebody and we put them on oxygen therapy simultaneously, the circulation in the spine is so improved during that time that we can actually kind of nourish the lower spinal cord and nerve system while we're decompressing it to increase oxygenation and glucose flow. So decompression therapy is one of the cornerstones of our approach. But while you're on decompression and you're breathing oxygen simultaneously, we also have you on a vibration device for the feet. And vibration is great stimulation for the lower nervous system. So you're getting decompression, oxygen, and vibration simultaneously. It's a very effective way of increasing stimulation and nutrition to the nerves in the spinal cord. Another great method is laser light therapy. Now we have 2 delivery modes. We have a pad and a probe, which we will use on your lower spine to treat the source at the spinal cord level. But we also have a special boot or an anodyne therapy that is a light that is surrounding the lower extremity that we have you wear there as well. And we use the light therapy, laser, and oxygen decompression. In addition, we also do corrective chiropractic care for misalignments of the spine, and we do neurological rehabilitation. So what we'll do is examine you. We'll find that you have a neurological deficit on one or other side of the body, and we will do neurological brain-based rehabilitation as well. Now, another key component to our protocol is nerve mobilization. Now, nerve mobilization is just as it sounds. The nerve comes out the lower back and down into the legs, and it crosses through a lot of fascia, a lot of tissue, a lot of muscle, and it can get caught in old injuries like a hamstring pull or a bruise or a broken leg or shin splints or what have you. And what we'll do is test you for these adverse neural tension points. And we have a specially trained massage therapist who will spend enough time as necessary in repeated sessions to actually mobilize the nervous system, whether it be with cross-tissue cross-frictional massage, specialized stretching, and we will actually flush the nerve and stretch it and free it up into its adhesions. And so now the nerve is gliding, it is relaxed, and there's slack in it. It will improve the circulation and it will improve the nourishment in there. Right. So on a typical visit, what we would do is first examine our patients. So the exam would include reviewing all recent blood work or sending out for a complete blood panel. We would check for anemias, we would check for blood sugar disorders, we would check for digestive disorders, we would check for your hemoglobin, hematocrit scores, and we would check your tissue saturation of oxygen and your tissue perfusion. So what we do is see how much capacity you have to carry oxygen and how good the delivery system is. And what a good delivery system is a 3.5 to 4.0 perfusion and a 98 to 100% saturation. Frequently, our peripheral neuropathy patients have perfusion scores less than 1, and that's very poor circulation. And their saturations are 96, 94, 92, and so forth. And this is frequently, unfortunately, caused, like I said, by anemias caused by lack of acidity in the stomach, caused by antacids, high blood pressure medication, and unfortunately statin drugs. Now I advise you not to go off these medications without consulting your doctors, or more importantly not understanding why the medication needs are there and addressing them before you lower those medications. So our protocol works slowly over time to wean off of medication. It should never be done by yourself suddenly without the supervision of your physician. All right? So I just want to make that clear. But after we examine you, we also do a neurological exam where we will have a scoring system developed in Toronto that will grade all the peripheral nervous tissues sensibilities: cold, prick, warm, touch, vibration, and so forth. And a perfect score is 76, so we'll grade you against that score, and we'll be able to monitor that on successive examinations to see how your neuropathy is improving. So after we do the initial blood work, we'll also do the mechanical exam. We'll review your MRIs, we'll take x-rays, we'll do a neurological, mechanical, and metabolic review of your systems, and come up with a protocol and recommendation for care. But if we accept you as a patient for care and you're a good candidate for the program, we'll first go over the nutritional recommendations to manage your case on the home front, both including nutritional supplements and diet changes. We will then recommend glutathione therapy to do at home. And then here in the office, our typical protocol would be for a patient to come in, lay down on a chiropractic bench, you will receive a chiropractic adjustment to realign the spine, decrease muscle tension, and neurologically balance the cerebellum. After that session of a few minutes, you will be then sent over to receive decompression therapy. Now, decompression lasts about 10 to 12 minutes. While you're being pulled and relaxed, you'll be breathing concentrated oxygen and receiving vibration. After that session, you will then lay on a laser pad for the lumbar spine and also receive some additional vibration for 10 minutes. And then you will receive the anodyne or the boot laser therapy directly on the feet to circulate and re-stimulate the nerve growth in those areas. While you're receiving the anodyne or the boot therapy, you also will be receiving concentrated oxygen in addition. So our program is very comprehensive both here in the office and at home. And if you're a good candidate and you're interested in learning more about this, please call the number on this website and we'll be happy to discuss it with you further if you'd like to get examined. Thank you very much.
I think the back pain affects all qualities of life.
I would be, I'm sure, very irritable and not much fun to be around.
My back pain keeps me from doing things that I normally do.
I was actually training for a marathon.
Overall, it keeps me kind of slowed down.
Used to be able to run, 25, 26 miles, and it was reduced down to maybe 3.
I would have to take too many over-the-counter medications.
It gets to the point where sometimes it's a shooting pain.
A constant ache
down the back of my leg and a lot of discomfort.
Causes headaches, and I have difficulty turning my neck.
It's just always there, and there's always an underlayment of pain that rises and comes back daily.
Frustrated with back pain? Feeling like you're enduring life rather than enjoying it? Well, you're not alone. More than 65 million Americans will experience back problems this year. Only the common cold causes more people to miss work. And you're not alone if you've spent hundreds or even thousands of dollars on treatments and medication. This year alone, Americans will spend more than $50 billion treating back and neck-related pain, many times only experiencing temporary relief. What if you could finally get more permanent relief? What if there was an alternative to medication, painful exercises, bed rests, and surgery? What if you could finally enjoy your life again? The great news is you can. How? With DTS spinal decompression therapy, a leading non-surgical alternative for disc-related syndromes of the lumbar and cervical spine. This comprehensive treatment has already proven effective for back pain sufferers around the world. In fact, many patients feel relief after their very first therapy session, and some 7 out of 10 patients who complete their treatments walk away with their back pain totally eliminated. So you're not alone in your back pain, and now you're not alone in starting this exciting new therapy. You're joining thousands of people who are experiencing back pain relief thanks to DTS spinal decompression therapy, the safe, comfortable, and long-term solution to your back pain.
Every time I come off the DTS table, I mean, I do feel much better.
I think it can have a great impact on a lot of people's lives, just like it has on mine.
There is a therapy that can help those problems in their neck without surgery, without drugs, that's safe, and it works.
You can feel confident knowing that the developer of this revolutionary decompressive treatment is the world leader in physical therapy equipment design, with over 8,000 systems installed worldwide. Although DTS systems have primarily been used in hospitals, now, through advancements in manufacturing technology, DTS therapy is also available in many clinics and private practices. In many cases, back pain is the result of an accident or injury. In others, pain has resulted from day-to-day stress and simply develops over time.
I always attribute it to just getting older. One of the things that I assumed everyone went through. And then when I realized that it's actually a compression problem in my neck, that I don't have to feel like that.
In order to understand what makes DTS spinal decompression therapy so effective, it is important to first understand the structure of the spine and the discs of the back. In the simplest terms, over the years, the spinal discs of your back and neck take the brunt of the compressive forces of gravity and stress. Small, minute tears in the outer structures create weakness in the discs. When stresses due to movements or an injury increase the disc pressures, a failure of the shock-absorbing qualities of the disc cause pain and muscle spasm. Although muscle spasm is the body's way of dealing with instability of the spine, it causes excruciating pain.
I could not even stand up straight, or even I had a hunch over. I couldn't move this leg, period.
There were days where I would almost be in tears. My back hurt so bad.
DTS is a comprehensive treatment plan which uniquely addresses your back pain through 3 phases of therapy. Typically, the sessions last less than 20 minutes, and, unlike other alternatives, your comfort and safety are of primary importance. In fact, in order for DTS therapy to achieve the ultimate objective of complete rehabilitation, you must be 100% comfortable.
It's wonderful. It doesn't hurt. In fact, at one time I fell asleep while I was having the DTS therapy.
Let's get started. Decompression therapy is delivered utilizing the table, traction motor, and a specially designed belting system. Our trained staff will place you in a custom-designed harness while fully clothed and adjust the harness to fit your body size and shape. Again, at no time should the treatment be uncomfortable or painful. Once the computer traction device is set, the treatment begins with a very gentle progression towards a decompressive or what might feel like an anti-gravity state for your spine. While you're lying in a relaxed and comfortable position, the DTS system does the work, stretching and distracting the spinal column, creating a vacuum effect that decompresses the discs within the column. This vacuum can, in many cases, help retract or draw in the herniated disc that may be pinching a nerve. Most patients report this as a comfortable, stretching sensation.
It feels like a very gentle tug, almost like what it would feel like if I were hanging upside down and stretching out my neck just from the weight of my head.
The first phase of the treatment should give you dramatic reduction of your painful symptoms.
When it was done, I got the table. I was like, wow, that feels really great. My back was really loose, and I mean, it just felt great all the way from here down, which normally is pretty tight.
I haven't had a pinched nerve since I started this.
The primary goal is to get you as pain-free as possible, and then introduce much-needed mobility to your spinal column. The decompressive portion of the DTS therapy system creates negative pressures or a non-compressive state to the discs, helping to bring blood supply and nutrients to the discs to begin the healing process. Our initial goal is to restore the body's own healing mechanisms that are temporarily lost during the acute phase of injury. Placing your spine in a decompressive state will help take the pressure off the nerves that are causing you pain. The treatments last anywhere from 15 to 20 minutes. Your technician will then let you rest quietly and will return at the completion of the therapy session. If you are uncomfortable for any reason, you have the ability to immediately stop the treatments with a press of a button. When your doctor feels your spinal discs and the muscles that support them are stable enough to start the biofeedback-based core exercise and strengthening program, you will proceed to the next phase of DTS therapy. Fortunately, your painful symptoms may be substantially reduced by this point, but the structures supporting the spine are still in need of repair and retraining. And again, this is crucial for long-term recovery. And that is why it is necessary to continue with the exercise and stabilization portion of the DTS spinal decompression therapy.
On an ongoing basis, as I repeat the therapy, my neck will actually get stronger and the problem might correct itself without any other treatment.
From this point forward and leading into phase 3, you will be performing the exercises in our clinic and at your home. Continued blood supply, enhanced by decompression of the discs, is ultimately what promotes healing to the damaged structures of the spine. Remember, this is a treatment plan with the goal of long-term recovery. Even though the pain you originally felt may finally be gone, that is not an indicator that you are fully healed. The damage may go much deeper, and the process of healing your back takes time. Therefore, you'll need to continue your home-based exercises daily for a length of time. Restoring you to the lifestyle you've been missing is our goal. Utilizing the most current technology in decompressive therapy and focused rehabilitation is the foundation of DTS spinal decompression therapy. Together, we hope to return you to the function and lifestyle you desire. This is our highest priority.
It is wonderful to have an option like DTS therapy that allows me hope that my problems in my neck will continue to get better, not worse.
I am very grateful for the DTS system.
The pain has been relieved and I can live a better life.
The DTS therapy system and our highly trained staff, together with your hard work and determination, is the best solution available to substantially improve your condition and live the life you want to live. Corrective Chiropractic is proud to offer DTS spinal decompression therapy to our patients. Please contact us with any questions you may have at 610-518-3370 or visit us at our website at www.correctivechiro.com.